And welcome to the Chakra House of Healing. Today I have the honor and privilege of having Dr. Oksana Sawiak with us today. And you're a wellness consultant, but you are more than that.
My background is dentistry.
Right.
For 42 years I was a dentist, and 30 of those was holistic dentistry. And so I took a lot of interest in things of health, and of course how dentistry affected it. And when I retired from dentistry, I got my Doctor of Integrative Medicine, and trying to integrate everything into helping people get healthier.
So holistic dentistry, that's a new term, I think, for a lot of people.
Holistic dentistry is not recognized by the licensing bodies as being any other different kind of dentistry. Maybe that's true, because every dentist is holistic in the sense that they do affect the whole body.
Right, okay.
But not many of them are aware of that. The dentistry has, unfortunately, veered away from being a health profession into being tooth carpentry. And what I am finding is that more and more dentists will do a root canal preventively, or will cut down a tooth that is totally alive and well for cosmetic reasons.
Okay.
Or they will do orthodontics on a child by extracting teeth and just collapsing their whole bite. Those are the kinds of things that I get upset about, because it does affect the whole body. And when they clean teeth, for instance, without checking whether the gums are infected, and push everything that's in there right into the bloodstream, that, of course, affects every organ in the body that the blood supplies.
Because when you think about your teeth, you just want them to be white and shiny and not full of cavities and stuff. So you're not thinking about, well, they're doing this, and what is that really doing to the whole body? My teeth look great, so yes. Everything must be okay.
And we are very much in the era of cosmetics.
Right.
A smile is an absolutely necessary component of our wardrobe.
Right.
And also absolutely necessary for success in our lives. So if you don't have a smile that you can confidently smile with, your whole life is going to be affected. Right. Your career might be affected. Your relationships might be affected.
So when you were mentioning the gums. So let's talk about the gums a little bit.
Okay. If the gums are infected.
Right.
And in 87% of North Americans, they are.
Right.
It is the most common infection in the world. Then when they are infected and you manipulate them with cleaning them with a scaler or an ultrasonic scaler even, what you're doing is you're pushing whatever infection is in those gums right into the bloodstream. And there are many problems that will entail, because, for instance, Alzheimer's has been found to be partially caused by a spirochete that is found in gum disease.
Oh.
Another thing, many people get what is called acute bacterial endocarditis and end up having to have a heart valve replaced. Many doctors in Europe will ask you right off the bat, did you have your teeth cleaned, when they see this? Because the bacteria that are in the gums, the parasites or the fungi, do circulate in the blood. And if you have a heart valve that maybe is a little scarred, or maybe has had some toxins on it, or maybe you've been born with a valve that doesn't work well, those bacteria, viruses, or fungi, or parasites will settle out on that valve, eventually infect it so badly that the valve has to be replaced.
So now everybody's probably, as you say this, I'm thinking, like, I have been fortunate in my life that I've never had a cavity, not even in my baby teeth, but I've had issues with my gums. And because my gums are so sensitive, when I go in, they always freeze me like crazy.
Okay.
You know, one side and then the other side, because they can't do it all at once.
So that's a symptom of either a bite that is that's interfering, or there is a low-grade infection there.
And the weird thing is, since I used to go for my cleanings once every 3 months, and now I don't go anymore. I made myself after one of your talks, I went home and I made myself my own toothpaste. And it was with coconut oil, baking soda, an organic baking soda, and I put in several essential oils like cypress, tea tree oil, a few different things like that. And ever since I've been brushing my teeth with just that, I have no sensitivity. My teeth feel great. I barely have to floss because the coconut oil like takes everything out of everywhere. And my mouth feels good.
One of the problems in today's society is that we are sold a bill of goods with the advertising. And the toothpaste companies really don't put all the ingredients on. There was a lecture that I attended in the 70s by Dr. Bhaskar, who was the dental surgeon general of the U.S. Army. And he said, "Do you know what's in your toothpastes?" And he said, because somebody asked me that, and I said, it should be fine, right? So when that question came up, he put the 10 top brands of toothpaste into the pouches of 10 of his, in the morning, when he came back, 8 were dead and 2 were very sick. And that's when he started looking at what is in toothpaste. We know now that fluoride does not help to prevent decay, but it does cause severe toxicity to our body, especially to our thyroid. And there are a lot of products in there, like sodium lauryl sulfate and propylene glycol and all these other things that have no place going into our body. They cause cancer, they cause toxicity, our livers get fatty, and we're putting a whole ribbon of the stuff on our toothpaste.
At least twice a day.
And toothbrush, yeah, twice a day. And children are exposed to this amount of toxicity. And I keep telling, do not give children any toothpaste until they learn to spit out. And they don't learn that until about the age of 5 or 6. So those are the kinds of things that I really get passionate about.
So you have this great thing about mental and dental, and how they how they coincide. So mental versus dental.
I lectured at the Ontario Association of Naturopaths last year, and they were quite amazed. Dentistry uses a lot of metals, for instance. One of them is amalgams, which are half mercury. If we had as much mercury as is in the air of the average dental office in any other industry, the industry would be shut down.
Really?
This is because dentistry still uses mercury amalgams in the mouth.
And that's in the fillings.
That's in the fillings. You don't have any.
No.
Thankfully. But the average person does. Our parents had mouthfuls of them. The mercury that's given off a filling as you're chewing, as you drink hot coffee, is very significant. This is one of the things that will cause Alzheimer's, Parkinson's, dementia, memory problems, stuttering, shakes, and chronic fatigue. So one filling might not do it, but a mouthful will.
Now, there was something else that you said during that discussion that I was at, and that sometimes a dentist will use a certain type of metal in your mouth, to say in one of your fillings or something, and then in another one they'll use another kind of dental metal. And then you referred back to batteries.
Yes. When a tooth breaks down too much, you end up with a crown. And most crowns are based on a metal and then covered with a porcelain.
All right.
The metal used to be gold and platinum. Now gold is very expensive, platinum is expensive, so they put other metals in. One of them is palladium, which is very toxic to the body. But it is a soup of metals that is in that crown. And when you think about your high school physics, when you put two dissimilar metals together, that creates a battery. When you have a battery, any battery will lower the resistance of the body or will weaken it. And I can show that on anybody, even with a battery-operated watch. So when you have a crown on this side and filling on that side, and perhaps a partial denture with a metal connector in between, you have a scrambling of the acupuncture meridians right across the midline, just like with an electrical wire or battery.
So you're just going to the dentist to get some work done, and you're completely unaware of what is going to be the long-term damage to yourself from that. And that is a scary thing.
It is scary because dentistry does not, it's taught, but it's not made very clear as to what parts of the body are being affected. For instance, a root canal can and does cause cancer. I have not seen one case of breast cancer that did not have a root canal, an infected tooth, or a toxically filled tooth on that meridian, on that side, in the 35 years I've been aware of it.
And that in itself is the scariest thing ever.
Yes. And when you have thermography for breast cancer, quite often you can see the red line going straight from that tooth all the way to that cancer. This was proven in the 1920s by Weston Price and proven again and again by scientists. But belief systems, unfortunately, are at work here.
There's a lot more at work here than just belief systems. Anyways, we have to head to a Zen break. We'll be right back.